our 16 counties, we heard that they really lacked the business acumen, and they were unsure really about all of the steps that were required to become licensed. It's a highly regulated field for all the really good reasons, but that makes it super hard to enter. And then the other piece of that was really around capital, because particularly in the more rural areas, we were targeting women who traditionally have less access to capital, may have in these more rural areas no credit or poor credit. And so we were really looking to also, in addition to providing this incubator and laboratory experience where they learn, provide them with access to capital. The final piece of that was that everyone, or is, it's an ongoing program, is that everyone also has an individual business advisor and an individual childcare mentor. So we've got the workshop component where people are learning concepts, they're working in workbooks, but then they have individual business advisors and childcare mentors who help tailor the needs to their specific community. So with that, I'm going to pause, and Nicole and I, who've had a couple of chats, Nicole, I just want to ask you, is there anything else you think I should mention at the outset before we dive in?
Yeah, potentially. We talked that Cynthia has a wealth of information. So in a short time, we're trying to hone in on what might be most useful to you guys. So we hope you ask questions, but can you talk a little bit about how you potentially work in the county context to help providers identify spaces? Because I know that that is a real barrier.
Yeah, great question. And, I have to tell you that it's different in every county. Our counties are very different, as are all of your counties, right? And so in some counties where we have anchor employers, that was a really great place to start because those employers were looking for workers. And so that was a place to start, having them either maybe identify something within their space or what kind of connections they may have in their community. In another community that I can think about, a dollar store had closed, and county folks brought in some of the town officials, and we worked together. The county helped the town buy the dollar store, and the dollar store renovated it and is splitting it into 2 childcare businesses. And we partnered with so many sources to try to bring together the funding for that. Really led though by the county, who had seen this heightened need in one particular community. I should also say that in areas that are sparsely populated, sometimes churches are a great place to start. And they may have space and they're willing to lease it out at an attractive price point or at a flexible kind of rate. And so we've worked on not just your standard kind of, monthly rent kind of deals, but we've really helped to think about what about percentage of income or percentage of based on the number of children or something like that. I should say that the program is agnostic. And so we really work with individual counties and communities to identify their needs. So we have helped start nonprofits, for-profits in your home, outside of someone's home, and also cooperatives, which I think it works in certain types of communities where you have a lot of similarities among citizens and residents. Great. So, questions and comments right at the start before we have questions we can ask, but I wanted to see if there was anything there that sparked some conversation or some questions or something you'd like to dig into.
Cynthia, I could probably ask questions all day, but I'll just ask one. Can you talk a little bit more about kind of the most common financial models that you see, not only for capital, but then ongoing programmatic expenses?
Yeah, I'm glad you asked that. I think that because there is a role for the counties to play in that, particularly as we're seeing additional funding coming down from the federal government related to the pandemic. So I would say there is no one size fits all, and I'm sure that really disappoints you. I would say, I guess I'm going to answer this in 2 ways. So first, I'll talk for a minute just about the program that we set up and the funding for that. And then I'll talk about funding for individual childcare providers and how communities might be engaging in that, and particularly counties. So the program that we developed is funded by both through government funding and also private philanthropy. So it started off with the U.S. Department of Health and Human Services, and we were working in some selected rural counties to test this out and pilot it. We were only a few months in, and a county came to us, and then a town came to us and asked us specifically to work with them. And then private philanthropy came in, where they had an interest in certain counties. And so that's what funded, or still does fund, our program. For the childcare providers themselves, traditionally, the onus has been on the childcare providers, right, to come up with the down payment and to assume loans. As someone mentioned in the introductory comments, the margins are razor thin. And the reason that the margins are so thin is because it's highly regulated for all kinds of good reasons. You know, the number of kids is tied to the number of teachers. And so labor is the biggest cost. And so there's either a race to the bottom to pay the lowest, which creates turnover, and you can see why the margins are thin. So traditionally, debt has been the instrument that's been used to start childcare. But we have seen communities either using block grants or other funding, and counties coming in and offering grants that are providing infrastructure. Now, infrastructure is generally defined relatively loosely. It could be a net new building, it could be renovating existing space, and frequently it includes buying little tables and chairs and musical instruments and toys and games and educational development. So I think that the opportunity for counties is really to think about how can you jumpstart activity in your home area? And can you do that by providing some programming that helps someone go through the licensing process, find that location, and start that business? And I cannot think of an example where a county or any government entity has funded a childcare startup entirely. So the most common type of funding that I'm seeing from a grant standpoint, which is right in that foundational level, is about 50% of the total startup cost. I guess one other data point, and it's not exactly what you're asking, but it's really interesting. I'm just doing some work with the state on some place-based work, and the price per slot is significantly lower to start in family-based or home-based care than in a center. So per slot. I was surprised to see how much the difference really was.
Thank you. That's really helpful.
Other questions, comments? Someone's asking in the chat, what's the screening process for childcare workers? So it does vary by state. Most states have a fingerprinting process, a background check process. It's regulated by the state.
I have a question or a thought, or maybe both, to you, Cynthia, but also anybody else that's on that may have any experience with this. So, you know, finding the space that works to really support high quality can be a challenge. You know, you mentioned some examples of places that are often used, churches, church basement, storefront, those kinds of places are really super common across the country for childcare. You know, certainly where you see the real cutting edge stuff, it's often been built ground up, which can be, you know, almost unheard of in some places. But an interesting thing that we've uncovered in our work over the last decade or so have been some intriguing examples of where counties or municipalities, probably more counties, have had land. So not necessarily open land, but land adjacent to buildings, and have made some really creative use of that, which has actually enabled some pretty cost efficient ground up construction that has resulted in some real cutting edge stuff. So curious if you've seen any of that or if you have thoughts on it, because that, you know, it feels like an underutilized but really interesting approach to not necessarily needing to find an unused site, but just maybe a giant unused field somewhere or something like that.
Well, I'm really glad that you brought that up, Cindy, because open land and land that's owned by the counties, or it could be a municipality, is a gold mine in this situation. So, when you're starting a childcare business, we've talked about, and many others earlier today talked about the heavily regulated aspects of this. And it's not just childcare licensing that gets involved.
Right.
No surprise, the fire marshal, the state fire marshal's office, has a big say in childcare licensing and in that space. And finding a location is absolutely the hardest thing to do. And so what's great about open land, you can think about building that new. It's expensive, right? It's crazy expensive. And particularly today, in light of construction costs and significant delays. So I will share with you a really interesting idea that provides relatively quick access to someone who wants to start a business, and it comes off the shelf as already passed the fire code. So I know you really want to know what this is. Modular buildings. Modular buildings. They come off the line, pre-cleared, have passed the fire code. And if you look at what is referred to as a double wide, those in the state of Maine, our regulations, they can take 40 children. They tend to be relatively open. You can put up walls if you want. So I'm not talking your traditional kind of mobile home where you're going in and there might be a hallway and a bathroom and a bedroom and what have you, but there are some that are being used today for overflow schooling. So if schools are have an overflow of the 4th grade or they're building a new elementary school and they've got those overflow trailers that we all see, those are perfect. So if you as a county official have some open land, great to think about. Tell you about another county that had some schools that have aged out. Also in Maine, we're not just rural, like we're the oldest state in the nation too. And so what's happening is schools have started to consolidate. And so school buildings are sitting empty. So we have worked with several counties on repurposing some of those buildings. Now, sometimes they're not in the best of shape, but what do they all have outside? Playground equipment, right? And you need that when you're starting a childcare too. So we have started to work with some where we're hoping we'll be able to use some of that land outside, maybe to put a modular building on with a slab underneath it that's very secure, and have that playground equipment that's already there. Lowers that startup cost. Are there other ideas for some land that some of you may own that you can think of?
I don't know about land, but our area is so rural, and to have a going concern of a childcare center, you need to have 100 children. We don't have 100 children to put into one childcare center in one facility. We're kind of spread out, some farms, some little villages, some little hamlets. So we've really been talking about family childcare and building in family childcare, because you don't have to build it, because it's already there. And there are not a lot of things that you have to do to make it work for childcare. To make it work for your family, you have to do some things, but to make it work for childcare is not difficult. And the centers, we've had a lot of people say, oh, we can find a spot for a center for you. We can't sustain a center. You could put a bunch of money into it, but we don't have the population to sustain a center.
You're so right, Kathy, and I'm so glad you brought that up, because that's the predominant form of childcare in the state of Maine, is home-based childcare. And for many families, it's the preference because it provides an environment that is similar to what the child has at home. But for the reason that you're saying, in sparsely populated places, a family childcare business can be a great job for the owner, and you can start it for relatively little money. It still is a great place for county government to come in and think about, how do you find those folks who have an interest in childhood education and encourage them to take that leap? They still need that technical assistance, that to become licensed, to buy everything that is needed to become licensed, and to think about the financial aspects of it. But on average in Maine, to start a family child care, someone can do it for anywhere. It depends on what their home is like and what they already own, but somewhere between, say, $6,000 and $10,000. So if you think about it from the county government standpoint, making some grants available for $3,000 and $4,000, that can really make a difference and help someone start that family-based childcare.
I think the other thing that's good to make note of in terms of the availability of flexible fundings, we know that I do federal policy. So at the federal level, we're having a conversation about, are there capital resources that can be made available to help home-based providers improve their spaces, right? Because you have outdoor space requirements, depending on the regulations in your area, you have different configuration requirements for the home situation, but not a lot of resources for providers to be able to make those to make those modifications. And as such, you have a whole segment of the population that seeks to be unlicensed because it's just like it's too expensive. Like, you know, it kind of, the business model doesn't support partnering up with the regulatory side of things. And so in so much as we're hoping that new federal funding coming down in terms of dedicated resources for acquisition, construction, and renovation will support not just center-based care, but also home-based providers. Thoughts about how counties can actually utilize and leverage additional resources to make like flexible financing available for home-based providers to leverage that. Because we know even with new federal funds coming out, I don't think it's going to be enough to meet all of community need. We know it won't be. So thinking about the leverage opportunity there would be there, but something that Cynthia honed in on, and some of you, Kathy and Marty, who spoke, a lot of it is going to be predicated on what your community need is and where you see those gaps existing, right? And so like, you know, kind of channeling resources for financial products or funding that supports like the type of provider that you're looking to support would be helpful. And I don't know, Cynthia, if you have any thoughts about like creative financing, like, or opportunities to support home-based providers in improving their spaces?
Yeah, absolutely. So, you know, I think there are opportunities to, because the price point, the entry point is relatively low for family-based childcare providers, I feel like there is an opportunity to help them more than we have been. Yeah, here in the state of Maine, we do have a stipend program, just started in July as a result of some of the pandemic funding. So for anyone who starts a family-based childcare, they have a $2,000 stipend when they get licensed. So that sounds fine. I'm working with a group of immigrant women. It's in one of our more urban towns, but in any event, they need that $2,000 now to buy the things required to get that license. And so I would challenge many of the counties on this call, is there either a grant program or a bridge lending program that you could start to get them over that hump? As you know, I work for a community development finance institution, so we did come up with a bridge product to get them that, and to top it up. We've topped it up actually to 3,000. I'll say a few things about if you decide that you can establish some capital, a grant program to jumpstart is really, I strongly encourage you to think about that as it relates to family-based childcare. And thinking about potentially partnering with a local community development finance institution to make up the rest of that. So in the state of Maine, there will be an infrastructure grant program for childcare, and it will cover maybe about half the costs, and we will look to create a program that enables the childcare provider to borrow the balance of that. But with that state, in this case, infrastructure grant program, that gives them the equity, right? So if you can provide the equity, I mean, even if it's 10%, and then partner with a community development finance institution who will be willing to take a higher risk loan on, I think that's a real win. I will also say one thing about the family-based childcare. So Kathy was starting to allude to this. She said something like, you might have to make an adjustment for your family. right? There's no, because, maybe your family doesn't want to share certain spaces or what have you. So one of the ideas that we promote is if someone has an interest in family-based childcare and they have an interest in building a separate room onto their house, we have some plans on the shelf, if you will, that cost about $50,000 to add a room on to someone's house that is exclusively where the childcare business is. So it's slightly separate and, not as crazy money as building a brand new center. So could you, in the county programs that you have, allocate some grant money to help someone get started? I want to say one more thing about patient capital, and then I'll see what other comments and questions there are. When we think about debt and we think about, layering on maybe to an existing foundational grant, it's important that any of the lending programs, or if you do lending programs within your own counties, it's important that you really think about the childcare business in and of itself. So childcare businesses often they take children in who are eligible for subsidy payments. In many states, it can take 3 or 4 months to get up on that subsidy program. And so that's 3 or 4 months where that childcare provider is not getting income from those children. So if you're providing debt, can you think about being interest only for 3 or 4 months while the childcare provider gets up and running? And think about how patient you can be with getting that return on your loan. So I know we're almost done.
Yeah, we're almost done. When we report out, if anyone who has taken in information or asked questions, if you would consider just kind of sharing your thoughts, we're gonna have a group share out, report out, and we really want to get your perspective on what you want to know more about, what you want to hear more about, or what we missed. And would you consider sharing that with the full group when we return to the full session?
And Morgan, you're asking a really good question. So if you ask that in the full group, that would be great to kind of raise that up. And the